Do all doctors make a profit that's correlated to the drugs that they prescribe?
A couple things to know. First of all, that most physicians, all physicians basically, when they prescribe a therapy, someone else is actually paying, covering the cost. So either a health insurer or the government is actually the one that's reimbursing the pharmaceutical company for the cost of the therapy. But really, I mean, what's at the heart of the question is, are doctors' relationships and prescribing of a particular therapy driven by their particular, a particular company, a particular interest in a company?
Need to want to make money.
Right, exactly. And, one of the things to keep in mind is that, as a result of the Affordable Care Act, every single financial, relationship between a pharmaceutical company and a doctor is public. So you can, if you Google open payments, you can see open payments. Just Google that, and you can see every single relationship that a doctor has. And you'll see they're listed that some doctors, for example, are parts of what they call speaking bureaus. So they're part, a company engages them to go out and give talks on, related to whatever drug that that company is prescribing. They may also see that a physician is perhaps invited by the company to go and give them advice about a particular clinical trial. That's called consulting. You might see that there's some consulting. But get this, if a doctor goes in a conference, like the one I was just at, the MS conference, basically if they get a cup of coffee by going to the booth, their ID gets scanned, and that $1.50 coffee also gets registered on the database. So when people look at it, they're going to see every single relationship. Now that's what we know. Now, is a doctor's prescribing affected by a particular company's and their interest? Doctors are human beings, and they will go with what they think is the best medicine. I'm sure, some doctors prefer one therapy versus another different strategy. A lot of their interest around that is driven by their own experience and what they believe is the science behind a particular drug.
I will say that being in a neurologist's office and having my doctor spend 45 minutes laying out all the options, and I was actually quite wanting him to guide me in a certain direction. In his mind, he said, it really all depends what you feel like you want to do. There are pros and cons to every one. But I certainly agree that that's an individual experience.
It is, and I think the main thing that watching us is to say, if you have a question about, whether or not your particular physician, has a particular point of view or is influenced in a particular way, ask the question. Because, the information is out there, and you just ask the question, do you have relationships with companies? What is your relationship? You might be surprised to find, a number of doctors are increasingly saying, what, I'm not going to be involved with that. Now, they're still going to be prescribing, and they're going to look at the options, like you said, because there's 12 or 13 now, and they're going to walk through all of them. Some will be more comfortable with some versus the other. But, I'd say, it's really important that people be empowered to ask the question and say, do you have relationships, and what do they look like?